Good morning and good afternoon. It feels like I'm dreaming, especially with this timing of early morning at 6 a.m. in Chicago, talking to a global audience from my home. I had to pinch myself a little to wake myself up. I'm so excited and grateful to be here. My name is Soojin Jun, and I'm a caregiver turned pharmacist and one of 10 founding members of Patients for Patient Safety US. I'm going to take you to 16 years ago when my father had language, cultural, and financial barriers in accessing healthcare and experienced medication harm in the transitions of care in the United States as a foreigner. The title on the first slide, Journey to Zero Harm, No Mud, No Lotus, comes from my painting on a jacket as a walking gallery of healthcare artists. The lotus takes painstaking journey from the mud to become a flower, and I thought this perfectly aligned with the goal of zero preventable harm of WHO. We often look at the flower, but don't necessarily think about what happens in the water and the mud. In the piece, I painted names of those we lost in the mud, and in the stems, I painted those who have become advocates directly inspired by those losses. And they are usually their caregivers. I'm wearing the jacket in honor of all, as they are my inspirations and are literally watching over my back. And believe me, those losses were not in vain. I live patient safety, some friends tell me, as I reflect on different experiences in healthcare last 16 years. It turns out every healthcare interaction boils down to two questions. They are reminders to empower you. The first question is there health? And the second question is there care? In the space between and throughout the interactions in healthcare. If the answer is no to either question, it means it is time for action to be the change you like to see in the world. Listening to your intuition, you have power to change. Many healthcare systems are not designed to be equitable, but is waiting for your story and ideas for co-creation. It may sound simple, but it's not easy. I certainly did not have yes to both questions in my caregiving journey. This is my father, Gain Lee. He was very proud of this picture on the left in the newspaper when he was rallying against the injustice in South Korea, and he framed it. He was quiet and kind, but was not afraid to stand up for what was right. I moved to the United States when I was 14 with my brother, and my dad came over in 1996 after I graduated high school. He was diagnosed with stage 3 esophageal cancer in 2006 and only had emergency insurance. This is one of the last picture with my dad on the right. And guess what my profession was at the time? I was a wedding videographer, and it was not very helpful in caregiving journey. Because I had no experience or knowledge in healthcare, I put complete trust into the system, which was the biggest mistake. As you can see, he has gone through multiple facilities in his journey, from hospital, nursing home, and then he came home. Until he came home, I did not know about his new diagnosis of diabetes and his medication, sliding scale insulin. And I did not know what diabetes was, what insulin was, and thought I just follow what the doctor would tell me. There is an intricate relationship between food, water, and the body's glucose level when it gets measured. And my father often had both factors that could cause false reading: dehydration and the irregular diet and feeding. So when he would get the extra dose of insulin, that's what the sliding scale means, his body would crash because the sugar was now too low. We went to the emergency room, and they would restore the glucose and discharge him without any teaching and learning. And then we would repeat the same 2 weeks later. Concerns expressed to his primary doctor were dismissed. He said low sugar could happen sometimes when patients are on insulin. Distressed with worsening conditions, my dad sought options to get care in South Korea. We booked flights for everyone in my family because I couldn't let him go by himself. 1 week before our flight, he had severe abdominal pain and passed away. Although we don't know what truly caused his death, studies show multiple hypoglycemia can lead to early death. Prescribing and dispensing sliding scale insulin without proper counseling is like giving poison to patients and caregivers. This was a fatal omission, a type of medical error. When the number of patients with type 2 diabetes is increasing worldwide, this is something we have to pay very close attention to. What if it was mandatory to prescribe glucagon, an emergency injection you can give at home when a sliding scale insulin was ordered? Could an important teaching be triggered at that moment in time? What if we were informed of misdiagnosis and medication throughout the course? Could there be opportunities like a class as a new caregiver? What about health literacy, the so-called 6 vital sign? Could that be assessed? What if there were community health workers who I could talk to? What if the pharmacist took the time to teach us? Which I strongly believe that could make a difference. So I became one. So many what ifs, dismissed and missed opportunities. And I struggled with guilt and shame for years, even after I became a pharmacist. I just needed one healthcare professional, just one, who could help me and my dad understand what was going on. All founders of Patients for Patient Safety US who have either lost their loved ones or experienced medical harm themselves have felt similar helplessness in our journeys. We have this invisible superpower of empathy and compassion for patients and caregivers because not only have we been there, but have transformed our lives around the grief. We are committed to asking organizations in the US to commit to WHO's Global Patient Safety Action Plan of 2021 to 2030. Through our lived experience and individual expertise, we can help organizations co-create safer care. Every healthcare organization could benefit from patients' input, every single one, to keep the crystal clear focus intact. We need to heal healthcare to give space of healing to patients. So ask those 2 questions regularly. Is there health? Is there care? Especially to patients when in doubt. And that is the ultimate focus we need in healthcare. Empathy and compassion are what we need to infuse in that space in between. And that is what it means to have health equity. Not equality, but equity, which means meeting patients and caregivers where they are at, without judgment, understand with empathy, and co-create solutions with compassion. There is no difference between patient safety and equity to me in this sense. Let me take you to the last moment with my dad, who was in so much pain, but utter thank you to the nurse injecting a painkiller for him. The nurse was so moved and said, "Oh, you are not in a place to say that." And she kissed his forehead with so much love. I don't remember her name or face, but the way she made me feel, and probably my dad, was a true gift. Although I thought to myself and asked God, why couldn't there be someone like her earlier in this journey? Then he took the last breath. This moment was the last gift from him and the nurse. And I hope you can place this story into your wound of your heart so you can start healing. The picture in the background was taken at a place called Big Sur in California in my slide, where it looked like the sky and the ocean were becoming one, which made me feel like that's where anything was possible. That is my dream and healing space. I snuck it in the presentation for you. Although I cannot see you now, and you are in my dream, where I dream no more harm with medication. Rumi once said, the wound is the place where the light enters you. Allow the light to enter you, and I urge you to be champions of patient safety, and where you are in the way you can, to spread that light so that there is health and care in every healthcare interaction. Thank you.